Why is BEP chemotherapy so successful for testicular cancer? Imagine a treatment that has transformed the outlook for men diagnosed with testicular cancer. That's what the combination of bleomycin, etoposide, and cisplatin, known as BEP chemotherapy, has achieved. This regimen is considered one of the most effective treatments for testicular cancer, especially when the disease has spread beyond the testicle. Its success is rooted in how it targets the unique biology of germ cell tumors and the way these drugs work together. Testicular cancer, particularly germ cell tumors, is highly sensitive to chemotherapy. Unlike many other cancers, even advanced cases often respond very well to treatment. This high sensitivity is partly because germ cells are more vulnerable to DNA damage. Cisplatin, one of the drugs in BEP, directly damages the DNA of cancer cells. Etoposide interferes with enzymes needed for DNA repair and replication, making it harder for cancer cells to recover. Bleomycin causes breaks in DNA strands, further damaging the cancer cell's genetic material. When these drugs are used together, they attack cancer cells through multiple pathways, making it difficult for the cancer to develop resistance. Clinical studies have shown that BEP chemotherapy achieves very high cure rates. For patients with good-risk metastatic disease, cure rates often exceed 90%. Even for those with intermediate or poor-risk disease, BEP remains the main first-line treatment, with cure rates around 85% and 70% respectively. These results are among the best seen in any solid tumor treated with chemotherapy. Because of its proven effectiveness, attempts to improve upon BEP by adding other drugs or changing the schedule have generally not increased cure rates and sometimes increased side effects. The success of BEP also comes from its flexibility. Doctors can tailor the number of cycles based on the patient's risk level. Patients with good-risk disease usually receive 3 cycles, while those with higher risk may get 4. This personalized approach helps maximize the chances of cure while reducing unnecessary side effects. Recent research suggests that even a single cycle of BEP can be effective in preventing recurrence after surgery for some patients, which can reduce treatment burden without compromising outcomes. This ongoing refinement shows how potent and adaptable the regimen is. Of course, BEP is not without risks. Bleomycin, in particular, can cause lung toxicity, which can be serious or even life-threatening in rare cases. Other side effects include nerve damage, Raynaud's phenomenon, and increased risk of infections. These risks are carefully balanced against the benefits, and treatment plans are adjusted for patients who may not tolerate certain drugs well. In summary, BEP chemotherapy is so successful for testicular cancer because it combines drugs that are highly effective against germ cell tumors, attacks cancer cells through multiple mechanisms, and can be customized based on individual risk factors. Its high cure rates have made it the standard treatment for metastatic testicular cancer. However, because of potential side effects, treatment decisions should always be made in close consultation with healthcare professionals. It's important to remember that every patient's situation is unique, and ongoing research continues to improve how BEP is used to maintain its high success rates while reducing side effects. Always seek personalized medical advice from qualified oncology specialists to ensure the best possible outcome.